Calcium channel blockers are another example of drugs that would work without any effect on the autonomic nervous system. And they are the same calcium channel blockers we were talking about as antiarrhythmics, blocking the L type of channel. But besides being in the heart, which is where primarily the drug verapamil and also diltiazem would be working so that they could decrease cardiac output, there are also calcium channels in the blood vessels, and it is the blockade of these calcium channels in the vasculature that would vasodilate. Pretty much all calcium channel blockers vasodilate, but by far in vivo it is the dihydropyridines, also referred to as dipines because of the prototype being nifedipine. It is those drugs that tend to vasodilate the strongest. Verapamil and diltiazem, because of their heart effect, are the ones that we can use as antiarrhythmic. If you know nifedipine, you know really the vast majority of these calcium channel blockers, since they tend to end up in dipines, such as nitrendipine, nimodipine, isradipine, felodipine, and you name as many dipine as you want in here. So knowing nifedipine will be a great example of those dihydropyridines. Here's a little figure that will give you an idea of, again, the kind of distribution you can expect from these drugs. And you see that whereas verapamil likes to bind primarily to the heart calcium channel and block it, well, nifedipine family, the dihydropyridines, they love to work on the actual blood vessel. As they work on the blood vessel and vasodilate, then notice that diltiazem is basically sitting in the middle and happily working both on the vasculature and the heart. Well, as uses, they can all be used for hypertension, they can all be used for angina, particularly what we call vasospastic angina. As far as antiarrhythmic, it is quite relevant to remember that only verapamil and diltiazem are approved for the use as antiarrhythmic. That is because with nifedipine family, the vasodilation and the hypotension could result in significant reflex tachycardia, a feature showing you how the nifedipine family of drugs do not really cause cardiosuppression. Now, we expect reflex tachycardia from direct-acting drugs, so as such, it doesn't make it a big point on the exam. We would like something unique for these drugs. Look what is unique. Nifedipine family is associated with a potential of gingival hyperplasia. Do you remember any other drugs that might do that? Well, if you're thinking about the CNS drug phenytoin, you're doing good. Phenytoin is actually more likely board tested for gingival hyperplasia than nifedipine would be. It carries the same type of risk. You get gum problems, you get gingivitis, then you're more likely to develop infection, maybe to those viridans strep. And it means that a simple dental surgery could then result in septicemia to these bugs with the potential of infectious endocarditis. Now, of course, I'm stretching it to the worst case scenario here, but it does point to us that any drug that has the potential of causing gingival hyperplasia should warrant us a warning and letting know the patient that they should absolutely tell the patient to see regularly a dentist or a dental hygienist. That gingival hyperplasia is probably not associated with anything with calcium channel blockade. I wish we knew how to explain to you hyperplasia, and certainly if I did, boy, I'd be working on cancer right now, obviously, and in pathology. So just learn it cold, just like you learned hypertrichosis for, minoxidil. Now, what else could we say? Well, verapamil, don't forget, can result in constipation, so a minor side effect.